Just days after hundreds of Minnesota Department of Health workers were laid off due to federal cuts, the state learned it could be getting millions of dollars back.
John Lorson explains what that could mean for those employees.
It was just a few days ago that the Minnesota Department of Health announced layoffs affecting nearly 300 workers, citing federal grant cuts made by the Trump administration. For the Minnesota Department of Health, the cuts amounted to more than $220 million. But Ellison announced that the state will get up to $250 million back thanks to the judge's ruling. This morning, MDH Commissioner Brooke Cunningham released a statement calling the ruling, quote, a bright spot amidst what have been some very dark days in public health. But she stressed that this is a temporary order, so the future is not yet certain, meaning that they're trying to determine what this means for the services that saw cuts, like mental health and substance abuse services, and disease management, among others. And of course, they're trying to figure out if this means laid-off staff members will be able to return to work. Cunningham went on to add that a temporary order like this does not mean immediate access to federal funds, and that more hearings will likely be held. When the cuts were announced last week, it became clear that they targeted federal funding that had been made available for pandemic-era programs. Despite that, Cunningham says those funds became extremely valuable and helped advance health infrastructure in Minnesota. John Lorson, WCCO News.
Keith Ellison is also one of 16 attorneys general now suing the Trump administration over disruptions to grants issued by the National Institutes of Health. That, too, will now play out in court.